Well, New South Wales has recorded its first Omicron-related death. Jessica Maggio is live in Sydney. So, Jess, what details do we know so far?
Kenny, New South Wales authorities have confirmed the death of a man in his 80s. He was infected with the Omicron variant. He contracted the virus at the Uniting Lilian Wells aged care facility in North Parramatta. He was fully vaccinated but had underlying health conditions. He's one of 3 deaths reported in the past 24 hours. Also, a man in his 80s and a woman in her 90s have died with the virus, though those deaths were not with the Omicron variant. 6,324 new infections were reported in the past 24 hours. Hospitalisations are slightly increasing. 55 patients remain in ICU, and authorities are monitoring that number as they are concerned that the Omicron variant is spreading, but certainly not out of control. They say they are managing the virus. New restrictions have been brought into place effective from today in order to curb that spread. Mandatory QR codes will be in place in hospitality settings and also public indoor settings. Cafes, pubs, clubs and restaurants must have a 1 per 2 square metre rule as well. These are very familiar restrictions that New South Wales residents have dealt with before. Also, masks have been mandated indoors. Those restrictions will be in place until after Australia Day on January 27, when authorities will review the decision.
We went to Warringah Mall, Warringah Aquatic Centre. Since 7 in the morning, we've been waiting over there for 8 o'clock opening. And by 9 o'clock, they shut down. No information given to anyone. Yes, I'm frustrated. And I'm also frustrated that nobody is actually talking about these things. We should actually do something about it. The government has given all the responsibility to private agencies. Hospitals won't do it. There are so many hospitals, they won't do the travel. Private would do it so they can earn money. And now they've taken the money and now they're saying, go find for yourself.
And Jess, testing sites have been inundated as pressure mounts on the system.
That's right, Kenny. As you would have just heard, we just spoke to a few people that have been turned around from the testing site behind me, as you can see in the CBD. Many of these people have been waiting hours. A lot of them require PCR testing for travel, for international travel in particular, but also for interstate travel. So they're having to pay for these tests, but are being turned away from testing sites. It's midday here. Already these people are looking for other venues to go to in order to return to their homes, particularly as they might have travelled for Christmas celebrations just this weekend. So those people are really in dire straits, looking for another venue. They must test within 72 hours and return a negative result if they're going to return home. Certainly frustrations are high here. Some residents have been calling on the government to create separate lines, separate queues at testing clinics in order to maintain that ease of testing for them and ensure that their results are being returned in a timely fashion. But certainly the testing clinics are being put under pressure. More than 2,000 staff have already been furloughed after being identified as close contacts of COVID-positive cases, and that system is only certainly coming under more pressure. So really authorities here are in a race against time to find a solution. They're calling for residents to use rapid antigen testing, but again, that's not readily available. There's also a cost that comes with that some people simply cannot afford. So while people are being told to use rapid antigen tests, there are certain requirements for testing at clinics, including PCR tests for travel, but also for those who are symptomatic and close contacts. So a bit of a tricky situation, but certainly frustrations are very high.